Building a better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We always ask the experts your questions every day at 3 to get answers for you in real time. Today, we examine the soaring prices of bike share rentals in San Francisco. A reporter with our media partner, the San Francisco Standard, looked into what's happening under the company that the city contracted with. Also, an Oakland working mom who has 2 kids under 5. She's had enough with preschool COVID rules. She's written an op-ed getting a lot of attention today, and she'll join us next. But first, a lot of new developments in the fight against COVID. The U.S. Surgeon General weighs in on the approval process for the 2-shot Pfizer vaccine for kids under 5. Airlines are demanding that the Biden administration drop the testing requirement for vaccinated international travelers. And new data that shows healthcare workers who got 3 shots were actually more likely to test positive on day 5 than those who got 2 shots. Joining us to discuss all these topics is ABC 7 News special correspondent, Dr. Alok Patel. Dr. Patel, good to see you.
Kristen, it is good to digitally be here with you as well. I'm waiting for the day when we're back in person.
Hopefully that day will come sooner rather than later. Let's go ahead and get started with 2 truths and a lie, because there have been a lot of headlines, and I know my Facebook Live viewers are already ready to jump in and help me out.
Oh, they're ready to pounce. All right, I can feel it. And it looks like today I can't see the screen, so I'm going to have to do this off my phone.
Okay.
But everyone knows the drill, and everyone knows that the way we're going to do this is you tell us which one of these is not correct. So here we go. Is it A, President Biden's new cancer moonshot goal is to reduce cancer deaths by 50% over the next 25 years? Or is it B, Novavax, a lipid-based vaccine, is now being reviewed for emergency use authorization in the United States? Or is it C, a preprint study showed 41% of those who felt fine to go back to work still tested positive between days 5 and 10? Which one of these is not true?
Okay, Facebook viewers, I'm going to rely on you because this is very tricky indeed. I read about the moonshot goal to reduce cancer deaths. I think it was 25 years. I don't remember if it's 50%. It sounds right. So I'm going to rule out A. I think that is true. A preprint study showing 41% of those who felt fine still tested positive. I know there's a significant number seemingly testing positive between 5 and 10 days, and that's significant because currently the CDC says you can leave isolation after day 5. I think C is true, so I think I'm going to go with B, but let's just do a quick check. Gregory says B, but he admits he's guessing. Megan says A. You know, I think, and Therese weighs in with B as well. So let's go with B as the lie.
Kristen, with your SAT test-taking skills, you never fail to disappoint. You are correct. B is, in fact, the lie. The reason why I included this here is Novavax is a protein-based vaccine, not lipid-based. They have good efficacy in the pre-Omicron era, just submitted for emergency use authorization. And what some people out there are saying, especially on social media, is that some of the vaccine hesitant public might be more receptive towards a protein-based vaccine than an mRNA one. And a lot of this is based on the misinformation surrounding mRNA vaccines. So I do think that represents an information gap. But hey, more options, more people vaccinated, I'm all for it. A is true. President Biden did announce this moonshot goal in collaboration with 100 different people, researchers, advocates in the cancer community. The one thing that we keep echoing is that with new treatments, with new cures, medications, whatever it may be, we just want to make sure that there's still access to everyone and it's equitable. I cannot say that enough. And C is, I think, what you were talking about at the top of the show, is that this preprint study showed that in healthcare workers, those who felt fine to go back to work, meaning they felt okay, they were taking that rapid antigen test and they were still testing positive, even more so in a boosted group. And we should talk a little bit more about that.
Well, okay, I had that down for later, but let's just talk about it now before people forget. Because what does that mean? Why is it that healthcare workers who were boosted, as in had 3 shots, actually were more likely to be testing positive on day 5? Because I don't want people to misunderstand that. I don't want them to think that, oh, that means actually if you're boosted, you're more likely to be contagious.
Me neither. And that is not what this study is saying at all, even though the headline is confusing. What this is basically showing is that compared to the pre-vaccination era, the time when we were a little bit more immune naive, if you will, people were building up a large viral load in their systems and then developing symptoms. And so in other words, now people who have a higher baseline immunity, such as those who are boosted, are actually getting symptoms a lot faster after an exposure. So the timeline to day 5 is different than the viral load. So in other words, people are starting their isolation a little bit sooner when they're boosted. So on day 5, when they're like, hey, I feel good, there still may be a rising viral level in their body. And so I know it sounds a little confusing, but the bottom line is that we can't just assume right now that day 5 through 10 means, hey, you're totally fine. You can go back and work with vulnerable immunocompromised patients. Don't have to worry about it. What this paper is basically showing is that we need to be a little bit more diligent about testing people out of that requirement, that day 5 to 10, especially if you're working in the hospital setting.
Right.
And if you can't test for whatever reason, you got to wear a mask and at least be aware of the fact that you could still be contagious.
Okay. Do you hope the CDC will actually revise its guidelines?
I do hope, but the CDC keeps pushing back and saying they want to be relatable. But I think the take home that the author still stress is that the boosters are working incredibly well.
Right.
This is just related to the testing.
Okay. Thank you, Dr. Patel. A couple big news headlines today, so I'm going to ask you about them. One of them is that the airline industry, they're asking the Biden administration to drop the negative test requirement for incoming international travelers. Do you think that's reasonable? Can we safely do that?
I think it's very difficult to actually make such a broad statement around all the international travelers as well. You know, I want to look more about this and see why they're doing that. Is there a bottleneck in testing that's causing this to happen? I would understand if there was some type of vaccination rate that needed to be met by another country for us to drop the requirement. But I think it's a little early without further discussion just to say that we need to get rid of it altogether.
Well, the main argument was that it's discouraging international travel when there's no reason to. And I was wondering about, you know, what do you mean when there's no reason to, right? I mean, I guess if you're looking at a country where they have much lower rates of COVID than us, then perhaps there it's not necessary. But maybe in places where COVID is raging, then it is necessary. Do you think it should be just kind of situational?
I agree with the situational component, and anyone out there who is saying, hey, we need to drop the vaccine mandates or get rid of vaccine, checks for any international travel. I ask, where have you been over the last couple of decades when we have vaccine requirements for all immigrants to this country, or when you're going yourself to other destinations?
Oh, yeah.
No one said anything then, but now
Right.
all of a sudden it becomes a hot topic.
That's right. Okay. Another hot topic, also in the news, Los Angeles Mayor Eric Garcetti was at the same NFC Championship game with San Francisco Mayor London Breed and Governor Gavin Newsom. And there was a picture of him out there where he's with Magic Johnson and Mayor Breed, also not seen wearing a mask. Now, Garcetti explained today that he held his breath while he was taking the photos. He said, quote, there's a 0% chance of infection from that. What do you think? Is that true or false?
In science, we never say 0%. I would have used a different word if I were him, because politicians are held, for better or worse, to a different standard. But I do side with the fact that if you're outside with a breeze and you're just taking a photo for a brief moment in time, it's okay to take your mask off. People did it a lot during the pandemic in the pre-vaccination era. Mm-hmm. If I got a chance to take a photo with Magic Johnson, my mask is coming off outside. That's just the way it's going to be. And so I think people need to take that into context and not just try to find these one pictures and use them as scapegoat tactics.
I see. Okay. A lot of people around here are saying, oh, we've never heard of that excuse before, or that explanation that I held my breath. And I said, really? Because I've done that. I've done that where I figure it's for 1 second, I'm going to pop in here and grab this and I'm out, or I'm just going to do this thing real quick and I hold my breath. I mean, I really do.
It makes physiologic sense. If you're transmitting virus, if you're potentially infectious, and you're transmitting it by talking, by singing, by coughing, if you block that passage, sure, that may work. And people have told me stories about they would hold their breath to hug their parents or whatever before people were able to getting vaccinated. And I get it. We're human.
Right. Hey, 2 quick questions. We have less than a minute. Are we really over the Omicron surge here? And if we are, do we still need to mask in supermarkets or walking into restaurants?
It really does look like we have moved past the peak of the Omicron surge. On the downslope, we still could see hospitalizations and unfortunately deaths, which lag those numbers as well. So I wouldn't just wipe my hands and say we're over it right now. And I do think we need to be really revisiting when we can lift those in-store mask restrictions. I stand by the decision to lift them in settings where everyone around you is fully vaccinated, including a booster shot. I stand by those. It's time to revisit them now for the next phase. just to build trust and give people an off-ramp, something to look forward to.
All right, Dr. Alok Patel, thank you so much. Don't go anywhere because you're going to stick around for another round of Two Truths and a Lie with us. Plus, we'll bring in the Oakland parent who wrote that op-ed about how preschool rules need to change. We'll be right back. Dr. Patel, here we are on Facebook Live, just hanging out.
What's up, Facebook fam?
I know. Facebook fam wants to know, Joe wants to know, what if you wear nose plugs?
Well, Joe, I mean, nose plugs, first of all, are not comfortable. I don't know if you have ever tried wearing them or swim with them, but also I guess you can still transmit it if you're screaming at someone's face. But I think we got to be reasonable here.
Okay. I can just see that now. Linda wants to know, should recipients that receive the J&J vaccine and been boosted, so I guess they've had 2 shots so far, get a 3rd shot?
There's not data to suggest you need to do that. And I would already commend anyone who got a J&J shot who went and got the mRNA one, but there's no data to suggest you need to jump out and get a 3rd one. If you have a specific condition, such as you're immunocompromised, there may be an indication there. And in those situations, hopefully you've already had a chat with your doctor.
Okay. How about, does a person with 2 shots who got a breakthrough case need a booster?
Ooh, that's a great question and one of a lot of debate right now. And the answer is yes, but it does depend on when you actually had your illness and what your illness looked like. If it was just a test and it was asymptomatic and it was more than a month ago, you do need a booster. But in many situations, doctors are advising you wait to get a booster if it's been within a month. But we do know that hybrid immunity is actually absolutely real and it does matter, but getting all 3 shots is your best protection right now.
Okay. How much time do we have? 40 seconds. Okay. Gregory,
you have enough time for me to ask if people bought the dip today on the Facebook stock, since we're on Facebook Live right now? Am I allowed to ask that question?
No, you're not. Okay, we're moving on. Gregory wants to know, indoor gatherings still okay if all are vaxxed and boosted, including seniors in that gathering?
I did that this holiday season. I did it, Dr. Fauci did it, and many other people who were talking about safe ways to gather during the holidays all did it. People were fully vaccinated. We tested as needed. Anyone who didn't feel well stayed home, and we gathered.
All right.
The science stands by that, and you can do that.
Great. And tests are a little more available now compared to, like 3-4 weeks ago. So, all right, coming back. All right, we are back with ABC 7 News special correspondent Dr. Alok Patel. Dr. Patel, welcome back. Let's do another round of Two Truths and a Lie.
Let's do it. Kristen, you're a rock star. Let's see if you can go 2 for 2.
All right.
Everyone, tell us which one of these is not true, which one is false. Is it A, this is the FDA's committee, VRBPAC, is scheduled to meet on February 15th to discuss Pfizer's vaccine for kids less than 5 years old? Or is it B, rapid antigen manufacturers like iHealth are not permitted to provide serial testing guidelines? Or is it C, the CDC's committee, the Advisory Committee on Immunization Practices, meets tomorrow to discuss Moderna's full FDA approval? This is whether or not they're actually going to advise it. Which one of these is not true?
Okay, Facebook friends, need your help here. I know A is true. They are meeting on February 15 to discuss the Pfizer vaccine for kids under 5. B is puzzling. I'm thinking, why would iHealth not be permitted to provide serial testing guidelines? However, I have a feeling that that is the right one. But before I commit, let me just go ahead and see what our viewers are saying. Haha, split between B and C, which is what I was, but more leaning towards B. Samson, Tanette. Yeah, I'm going with B. That's the lie.
Can't fool you all. B is in fact the lie. And I actually I specifically put that there because serial testing is essentially, if you get a negative test and you're unsure about it, it's a good idea to what we call serial test. Take another test. You want to do that at least 24 hours before the first one, but always look at the manufacturer's instructions. So if you have iHealth, it's right there on the website. And A and C are both important. I don't need to go into detail about both these meetings, but they're important because people out there need to understand that there are independent review committees who are looking at these vaccines, efficacy, safety, immunogenicity, and actually making sure they work. So just because a company submits for an EUA, it doesn't mean it's already out there and it's going to be happening. There is a very, very critical review process that needs to go on.
That is good to know. All right. And of course, you know, for the vaccine that you were talking about for kids under 5 years old, that protection can't come soon enough for many parents in the Bay Area, especially those with preschoolers whose lives are arguably upended the most at this point, and their parents. An Oakland attorney and mother of 2 kids under 5 wrote an impassioned op-ed published in the East Bay Times today. Cynthia Stein joins us now. Cynthia, thanks for coming on the show.
Hi, thanks so much for having me.
All right, well, you have a 4 and a 2-year-old, so I'm glad you found the time for us, and you have a full-time job. You are fired up. You say you've had enough and that preschool rules are nonsensical. How so?
Yeah, well, I mean, I wrote the piece, honestly, as you allude to, partly just as catharsis, right after I found out we were going to be out of school for another 5 days. Yeah, I mean, no one's blaming preschools here. I'm not blaming our preschool. Certainly they're following the rules, and the rules I think made sense at a time, but I don't think they make a lot of sense anymore. There are sort of a couple of reasons I wanted to draw out in the piece. One is that you know, with Omicron, it seems like we're in a position now where exposure is inevitable. It's everywhere, and we seem to be kind of accepting a society that you know, given now in 2022, we have the tools to really reduce the risks associated with an exposure. We're willing to take on some measure of exposure in order to have some degree of normalcy. You know, we're not shutting things down. We're not shuttering K through 12 schools, but for childcare and preschools, we kind of are living in that kind of world where any exposure means the entire class goes home for 5 days. Some schools are doing 7 days or even 10 days. And that just doesn't seem right to me right now, when childcare is arguably the most essential thing for kids and for their parents, for that to be the one thing where we're sort of not tolerating any risk anymore.
Right. I wonder if we can bring in Dr. Patel, right, to talk about what do you think would be some reasonable, safe alternatives? Like, for example, you know, she brought up the older kids and K and up, like there's the test to stay, right? Let's say a kid in the class has it, but then you test and you're not positive, so you don't have to go home. The whole class doesn't shut down anymore. Is that something to consider? What do you think?
100% think that's something to consider. I actually don't understand why test to stay hasn't been brought up in this age group. So I 100% agree with what Cynthia is talking about and her frustration here. And I also feel on the outside looking in that there's been a different level of priority for these kids to be in. This is still in-person learning if you're in childcare and preschool versus K through 12. And it also feels like we've neglected how important it is for parents to still live their normal lives, to be able to go to work, to be able to run their household while knowing that their kids are safe and taken care of. And kind of the fact that we can't predict what's going to be happening the following week just kind of adds to the frustration. And it also adds to a lot of the hope and the optimism I'm hearing about this potential vaccine for kids, because parents out there with kids under the age of 5, me included, we want our kids to have some form of primary prevention. So I'm hoping that solves this issue we're seeing right now with childcare, but it would be nice to see the same level of priority.
Yeah, Cynthia, so are you eager to get your kids the shot? I mean, I assume that is what you're looking to do, right? Hopefully, would your preschool then say once they're vaccinated, then they could stay if there was another positive case that wasn't them?
Yes, that's right. Although that's recent. In preschool, we sort of have this weird hybrid of some kids are eligible for vaccines and some are not. And so originally, everyone had to quarantine, whether you were vaccinated or not. They've recently changed that policy, though. So yes, unfortunately, my 4-year-old is still young enough. She turns 5 in a couple of months. I don't think she'll be fully vaccinated in time for that to, you know, us to take advantage of that for preschool purposes. But I'm absolutely looking forward to getting my kids vaccinated.
You know, your school also does twice a week asymptomatic testing, right, Cynthia? Dr. Patel, do you think that is still necessary?
I don't think it depends. I mean, let me take that back. I think it depends on the community, and it depends on the level of community transmission. But I would rather see a focus on tests to stay than to be arbitrarily doing asymptomatic testing, finding cases, shutting down schools, and not allowing this screening to bring kids back. Those two seem contradictory to me. This kind of makes me go back to the thinking where we would see schools shut down, but a bar open. Like, we actually need to take a step back and realize the number one priority is kids having an in-person learning environment. We're taking care of families, and schools being the last places to close and the first places to reopen.
Right. And Cynthia, I saw you also mention that, kids are allowed to attend mega events, right? Be it an NBA game or something else where the numbers suggest they would definitely be exposed. There's got to be someone positive near them. But Dr. Patel, can you tell us how well or not well comparatively that age group does when they are infected compared to older children, for example, under 5s?
Well, let's put it this way. We are fortunate to report that children still have a lower risk of getting hospitalized or severely ill, but they're not by any means immune. And in fact, with Omicron, we're seeing more kids present with these upper respiratory infections, especially the younger kids, the toddlers and the 3-year-olds. And kids are still absolutely at risk of developing long COVID or passing on COVID to somebody else. But I agree with what Cynthia also mentioned in her article, that it's also up to parents to assume that individual risk based on their own household. There may be a situation where a parent says, you know what, there was a case at school, we're allowed to come back, but we're just going to hang out a bit because we live with someone who's higher risk. And I think some of that onus has to fall on the parents. There needs to be some more kind of bi-directional conversations.
Yeah, we've got 10 seconds, not even, but I wanted to give Cynthia the last word. If you could give one message to policymakers, your local public health officers or CDC, what would that be?
Treat preschool the same way that you treat K-12 schools.
All right. Thank you so much, Cynthia Stein. Appreciate you being here. And Dr. Patel, as always, great to have your insight. Coming up next, we'll talk about the frustrations over the cost of Lyft's Bay Wheels e-bikes. One city leader in San Francisco is already preparing for the company's contract with the city to end. The San Francisco Standard will be joining us to talk about what's next. We'll be right back. All right, thanks for joining us, everybody. Great conversation. And the next one is also very interesting. So in the meantime, enjoy this lovely view our director has chosen for you, San Francisco Bay. Thank you. Welcome back. ABC7 is excited about our partnership with the brand new San Francisco Standard. Part of building a better Bay Area is highlighting those who are working toward the same mission we have at ABC7. The Standard's deep and insightful reporting on the city does just that. SF Standard reporter Sarah Wright did a deep dive into the Lyft-owned e-bikes known as Bay Wheels. Costs have been rising so fast, one supervisor is raising questions about the future of the bikes in the city. And Sarah joins us now to talk about her reporting and what she discovered. Sarah, nice to have you here. Tell us about the deal the city and Lyft cut. I know they operate Bay Wheels. Is this an exclusive arrangement?
It is an exclusive arrangement, and it started in 2015, actually before Lyft was in charge of the current Bay Wheels fleet. And so this contract basically gives Lyft exclusive rights to operate docked bike share in the city, which is why you only really see the black and pink bikes roaming around.
Got it. Okay, so what is the complaint that riders have been raising about the pricing? I mean, is it opaque? Is it too high? Is it too unpredictable? What is it?
I think all of those things, specifically for e-bikes, Kristen. So for regular bikes and for people who have memberships, it's pretty straightforward. You just go to a dock, you check out a bike, and as long as it's a short ride, it's really cheap. But as soon as you start using e-bikes or you go for longer than about 45 minutes, that's when the prices really start to rack up. And so we've heard a lot of issues from users saying, hey, we didn't know that our bill was going to be $50, for example. And that's what sort of inspired this story, was to find out just why those prices are so high.
I see. Now, is that a surprise in the sense that does the contract cover what Bay Wheels can charge and their disclosure of those costs?
Right. So the contract regulates the cost of a membership. So a membership is $159 a year. But what it doesn't cover is the price for anybody who's not a member or the price of an e-bike. That's in a separate contract. And those questions can all be answered by Lyft, and they have raised their prices recently. And I think that that comes as a surprise to a lot of users.
All right. Well, Supervisor Dean Preston has been keeping a close eye on this. What is he saying or doing about the Bay Wheels controversy and the pricing?
Yeah, so last year, Supervisor Preston called on the budget and legislative analyst to create a report to kind of show the city what their options are. So the contract that I mentioned before is up in 2027. So he wants to get started now studying the future options, looking at other cities, what their models are, and where San Francisco can go from here.
Got it. 2027. So what are some of the options? I mean, I guess they could renew with Lyft, right? But I understand some people are calling for a city-controlled bike share program.
Yeah, that's exactly what Supervisor Preston is interested in finding out, is what would it take to have a municipally run system entirely? So instead of the system we have now where Lyft basically owns and runs all of the bikes and docks, what if the city did that? Or what if it was like DC and Boston? Those cities have a shared agreement. So the cities will own things like the bikes, and then Lyft would be responsible for actually renting them out to users.
Got it. Sarah, we have about 30 seconds, but I'd like to know, why is this debate so important when you look at the overall big picture of transportation in the city?
It's really important because these bikes, for a lot of people, get them to the last mile that they need to go, whether it's their house or work or to visit a friend. And so when the buses aren't running or when walking just feels too far, these bikes are a way to get there. So a lot of people want to be able to use them any time of day for a reasonable price.
All right, Sarah, thank you so much. Don't go away. We can continue to chat on Facebook Live. We do have to take a break right now, but I want to let folks know we have links to the San Francisco Standard's other original reporting on our website, abc7news.com. And to watch more of their videos, check out our ABC7 Bay Area streaming TV app. We'll be right back. And we're here with Sarah Wright, who is a reporter with the San Francisco Standard, who's been looking into Bay Wheels and the pricing and some of the high costs that are kind of a surprise to people. So what's happening? Sarah, do a lot of people in San Francisco use e-bikes? Like, what are the numbers?
Yeah, so it's actually become an issue. The ridership in San Francisco started to go up and up and up, and then once the pandemic hit in 2020, it completely plummeted. And so Lyft, representatives from Lyft have told me they're pretty disappointed in the ridership numbers right now, and they attribute that mostly to the fact that a lot of workers haven't been going back into the office, and usually that's their typical rider.
But there should be a similar trend in other big cities like Chicago and New York, but that's not the case, right?
It's not the case. And I think that another factor that goes into this is just the high cost for Lyft to maintain these systems. So San Francisco, on average, loses one battery at each of its docking stations per day due to theft. And so those are kind of the barriers that Lyft is facing when they're trying to maintain the system and get riders to use it.
I see. How about other systems? I mean, if people aren't using e-bikes, are they using other things more, other options more?
Yeah, I mean, I think that's the big question. Like, are people turning to the bus? Are they walking? Yeah. I think that in some cases during the pandemic, the mobility of San Franciscans has just gone down in general. And so city leaders and Lyft are really looking to this program to help sort of revitalize biking. And, one thing that Dean Preston told me is that he's not just focused on bike share, he's focused on making biking easier in general for people in the city. So how do you create more bike lanes? How do you make it safer to get around the city?
All right, Sarah, right, really interesting information. Thanks so much for sharing your reporting with us.
Thank you.
All right, everybody. Wow, I loved all our conversations today. All right, coming back on air. And thank you for helping me with Two Truths. Thank you so much for joining us on this interactive show, Getting Answers today. We'll be here every weekday at 3 o'clock on air and on live stream answering your questions. World News Tonight is coming up next, and I'll see you back here at 4 o'clock.